There is a misconception about postpartum visits with your provider, and I really should say visit because it's usually just a 6-week follow-up visit. We often think that our provider would tell us if there's something we should be concerned about. This is not often the case. Your provider typically has very little time with you during that visit. They're just trying to rule out the major things with your healing. They're not assessing for your pelvic floor strength and how do those muscles relax, how's coordination, are there areas of tenderness or pain, do you have diastasis recti issues. They are typically not assessing for those things, but it doesn't mean you shouldn't be concerned about it because your pelvic health impacts the rest of your life. The pelvic floor muscles, for example, control so much, so many important things. Bowel and bladder function, for one. That's a major thing. Sexual function, that's another big one for people. You should be concerned about it. And in the US, we often just sort of breeze right through that part of postpartum healing, when in reality, that should be just as big of a focus as all your prenatal visits. And so how do we change that? See a pelvic physical therapist after you have a baby, regardless of whether you have major concerns at that time or not. There is a lot that we can do to prevent issues. We have so many women in the US struggling, really across the world, struggling with bladder leakage, pelvic pain, all of these things that we can address as pelvic physical therapists. But it's important that women have that information and are given that option so that they don't fall into that statistic. So if you have concerns about whether pelvic physical therapy could help you or not, please reach out. We can do a consultation for you just to talk and see, is this something that will benefit you? Thank you and have a great day.